COVID cases have been slowly trending downward in Wisconsin. I'm joined now by Dr. Jeff Potoff from UW Health. Dr. Potoff, we always love having you to put all this in perspective. So the first question, with these cases going down, does that mean that we have reached the Omicron peak now?
Yeah, I think it is fair to say that here in Wisconsin, we likely have reached the Omicron peak. It seems cases are going down statewide, hospitalizations are going down a little bit. I hope we can follow the same trend that other parts of the country, particularly the East Coast, have seen.
We're now hearing about a subvariant of Omicron. Have you seen any local cases of this so far?
You know, I've not heard of any local cases. There are cases out there. We see most of these cases up in the Norway, Denmark area, a little bit United Kingdom. I think there's enough similarities between this subvariant and what we want to call original Omicron, where I'm not too worried about big changes in infectivity or performance against vaccines.
And I just wanted to ask you about this. You mentioned performance of vaccines. What is the new information saying so far in terms of how the vaccine holds up against this subvariant?
Yeah, I don't think we have a lot of information, particularly around the subvariant, but I think it'll be somewhat similar to what we see with Omicron. And that is, if you have 2 doses of the vaccine, your likelihood of having any symptoms at all if you come across Omicron is about 60%, so a fairly high number. Now, if you boost that person, now they have 3 doses, the likelihood of any symptoms at all falls to 20-30%, so a good bump in protection with that booster.
Well, the FDA just approved the Moderna vaccine for people 18 and older. How will that change things?
You know, I think this might have an impact on those folks who are hesitant to get vaccinated because they're worried that these vaccines were approved under the emergency use authorization. This now makes Moderna the second vaccine, the Pfizer being the first vaccine, that's gone through the same rigorous review that any other vaccine that we get has gone through. So really should alleviate some of those concerns people have around the safety of these vaccines. You can't get any better than FDA approval. It's the most rigorous standards in the entire world.
And I know you don't have a crystal ball, but trying to look forward and thinking about the future of the COVID vaccine, what is the medical community saying? What is the research saying in terms of if we will need to get several shots annually? What do you see?
You know, it's hard to tell. We're trying to understand durability of the vaccines with that 3rd dose. You know, we have seen some places around the world, Israel, where they give a 4th dose that maybe has some benefit for those of the extreme of age or immunocompromised. I do think we'll likely get to a place where there is an annual COVID-19 booster. It likely will be matched against those variants that are the most common at that point. And it'll become much like a flu shot in the sense that we get a fair bit of protection from our annual COVID-19 vaccination as this virus continues to mutate and create variants.
Okay, Dr. Potoff, you always have helpful information. Thank you.